According to the official website of the World Health Organization, mental disorder affects one person out of every 8 people in the world, and it also causes severe imbalances in thinking or controlling feelings and behavior. But let's first learn about what mental disorders are in the first place and how they affect human thinking and mind. Mental disorders are a behavioral and psychological pattern that results in the individual as a result of feeling upset or helpless. These disorders are an abnormal growth of mental skills. These disorders may occur for different and multiple reasons, such as genetic factors, as studies have proven that there is genetic interference in the occurrence of some diseases such as schizophrenia, as well as organic factors are one of the most important causes of psychological disorders such as brain problems, because it is the center of the human body's work. But, in fact, my friend, what we mentioned previously is only the beginning of what I want to talk to you about now. I did not come to talk to you about psychological illnesses and how to treat them, but rather to devote space together to talk about classified psychological illnesses. You personally may be afflicted with one of them. Have you ever felt a strong desire not to get out of bed? I personally feel it every day. But let's make it clear. We are now talking, my friend, about clinomania, the clinical obsession. Although we all go through moments of complete frustration and feeling lethargic. However, a person with clinomania feels a strong desire to lie in bed all day, to the point of being impossible to resist. The real crisis of the owner of clinomania. He often doesn't get enough sleep to deal with this condition. But to make that point clear, clinomania does not necessarily mean sleep. It is a term that means lying in bed. If you think you may have clinomania, I will make you sure in a few moments that you are not suffering from philophobia. Philophobia, my friend, it is known as the fear of attachment in all its forms, fear of love, fear of marriage, and so on. In fact, if we strip the matter of humor, we will find that it can be tragic sometimes. Fear of love can negatively affect your ability to form meaningful relationships. Studies show that people who are most likely to suffer from philophobia, they are the ones who have suffered psychological trauma from parents in the past, who were abandoned as children. They will definitely have a negative reaction towards anyone who tries to get close to them, for fear of shock. A person with philophobia avoids emotional relationships to avoid feeling the pain he had experienced before. In the end, my friend, there are many psychological illnesses that we may suffer from without knowing it, such as joke-telling syndrome. And it is a rare medical condition. Some people suffer from it and resort to making jokes at inappropriate times. There is also hair-pulling disorder. This makes the person who suffers from it feel uncomfortable unless he constantly pulls out his hair from all over his body. Seasonal affective disorder. The state of love you feel towards everyone. In winter, and especially after midnight. I will conclude the video with you with Dr. Mustafa Mahmoud's words about mental illness, when he said that science classifies mental illness as the defeat of the will in the face of a sudden changing circumstance. I wish you and all your loved ones safety always and forever.